Good afternoon and welcome to our third Q&A session on COVID-19 vaccines and transplant, hosted by the Center for Living Organ Donation and the Ajmeri Transplant Center at UHM. These sessions are made possible through the generous and ongoing support of Astellas Pharma and the UHM Foundation. For those who are logging in for the first time to these sessions, my name is Joanne Carney, and 4 years ago I received a kidney transplant when my husband Brendan donated his kidney through the Living Kidney Paired Exchange program. I'm also a board member of the UHN Foundation, and I'm thrilled to once again be moderating the conversation today with our team of expert panelists who are at the heart of the COVID-19 pandemic in the transplant community here in Ontario. A lot has changed and a lot has evolved since we met a month ago, including a more intense wave of COVID-19 here in the province, where we are seeing our hospitals and our ICUs being pushed further to the max. We're also seeing a continued ramp up of the vaccination efforts across the province. So we really want to focus on how these changes are rolling out in the province and how that is impacting our transplant community. So we're going to start with general updates from our expert panelists on how that impacts their own clinics and their own patients. And then we'll hear from Dr. Kumar, the Director of Infectious Diseases at the Ajmeri Transplant Center, about the latest research around COVID-19 and the effectiveness on the transplant community. Following that, we know there's been a lot of questions and there's been a lot of changes about how do you access your vaccine? What are the logistics? So we're going to ask Andrea Northgate to walk us through that and give some tips on how we can try to make it as easy as possible to get vaccinated. And then we're going to tackle your many questions that have been sent in. And thank you again for sending in lots of questions and engaging with us on these sessions. So without further delay, I would like to start with our special guest panelist today from St. Michael's Hospital, transplant nephrologist, Dr. Prasad. We are delighted to have you here today, Dr. Prasad. And so why don't you start with telling us a little bit about how your program at St. Mike's has evolved through the reality of the pandemic and what you're seeing on the impact of your kidney transplant patient population.
I'm Dr. Ramesh Prasad. I'm a director of the kidney transplant program at St. Michael's Hospital. We currently cater to 1,800 kidney transplant recipients, some of whom have had their kidney transplants as far back as the 1970s. And really, the COVID-19 pandemic has kept us very busy. We are seeing a large number of our patients getting infected with COVID-19. Fortunately, the majority are either asymptomatic or doing relatively well. But we are seeing a proportion of patients, a significant proportion of patients getting quite sick from COVID. Patients have been to the ICU, and we've also seen some mortality as high as 15 or 20% in our patients. And I would say in all, out of our 1,800 patients, to my knowledge at least, we have about 70 to 75 patients who've actually been diagnosed with COVID-19 infection. We've adapted to the pandemic in a number of ways. We are seeing many patients virtually, mostly through telephone. And for especially those patients whose care is routine, their annual follow-up visits, for example, we are able to do these by telephone in the large part. But at the same time, we remain open to seeing patients in person if and when required. So if patients are quite sick related to a transplant issue and need to be seen in person, we are able to do so. And also if they're early post-transplant, we are seeing them in person. So we're managing, but definitely this is a pandemic that is a real challenge to us.
Thank you, Dr. Prasad, and thanks for bringing up the telemedicine. You know, as a patient myself, it's been great to see how the hospitals have been able to really quickly adapt to our new reality and bring in technological advances that have been really, really seamless from a patient perspective. So kudos to you and your team for making that possible. So let's move on to Andrea. Why don't you give us a bit of sense on how both the Living Kidney Donor Transplant Program has been proceeding throughout the pandemic, our surgeries going ahead, our assessment still active, and what does qualify as an urgent case in the context of this pandemic?
Well, as you know, it's like a very fluid situation. It's sort of like it seems to change week by week, and when you're in the thick of it, it seems to change hour by hour. However, whereas we used to get OR schedules like a month in advance, we're now getting them just a week ahead of time. And so unfortunately, some things did have to be canceled initially, but as we sort of move forward with modeling, sometimes it's safe to do so. We're just not able to schedule ahead of time like we used to be able to. Urgent cases are given consideration, such as a paired exchange like yourself, if there's like a long chain that a lot of hospitals and a lot of people people are actually depending on, they're sort of given a priority because you don't want to sort of cancel out on and affect so many, because one person affects so many other people's lives in that respect. But hopefully evaluations are still continuing, and as much online virtual appointments as possible. As we're just, like I said, it's just very fluid with all of transplant, but it is considered a priority program for the hospital, and which gives some solace for, some hope for a lot of patients.
Thanks, Andrea. It absolutely does. It is a very, I don't know what the right word is, but very good or very heartwarming to hear that, transplant is still a priority. You are still able to sort of make these life-saving surgeries happen. And I hope they continue to sort of ramp back up as we work through this phase. But I know it's a very challenging time for all the hospitals to make it all happen. So good to see that they do continue. Why don't we move now on to Dr. Chaparro? How about you give us a bit of an update from the lung program perspective and how your patients are doing through COVID, and what impacts we're seeing on the new transplants in the lung program?
Thanks, Joanne. Well, from the lung transplant, I think that we are happy, as Andrea was saying, we are really a very important program in the hospital. So we continue being opened. Again, the first wave, we were closed for a short period of time, but we are happy to really say we continue to be open to any transplants. Hopefully we won't have to close. It's been really difficult, and I know this creates anxiety for our patients who are waiting, but we hope we'll get a donor for everyone. In the post-transplant site, we continue being really flexible, adjusting as things happen. So we continue seeing patients similar to what Dr. Prasad and Andrea probably are doing in the program. We prioritize patients early post-transplant that we want to see. We want to make sure that they are doing well. We see patients virtually. We have the VB Hub 5, we have the video conference with Teams, so we have the capacity to really see them. And also through the VB5, we can get some biometrics so that patients can update us about their lung function, their temperature, etc. So it's really a good way to maintain certain contact with them. So we also, unfortunately, would have to had to cut on procedures that normally we used to follow up patients, bronchoscopies. So we also have been focusing only on the urgent ones. But we really are trying to maximize the care of our patients no matter what. So I think that in the middle of all of this, we want to emphasize protection for our patients. So keeping them away unless it's absolutely necessary. But I think we are coping well, and our patients have been coping amazingly well. Infections, unfortunately, yes, we have seen patients in this wave more than in the previous ones. Patients have gotten sick, some of them able to remain at home, or some other ones going to the hospital. And unfortunately, some of them getting very sick. We have been emphasizing the need for the vaccines, and there are circumstances in every person that we really try to help to try to make sure that everyone gets the vaccine no matter what, and be in their priority list. So we continue working on that. I think that's probably my update.
Great, thank you, Dr. Chaparro. But it really does hit home when you see the rising numbers of patients who are getting affected, who are coming to the hospitals, especially within the transplant community. So I think, as you said, it's important that we all get vaccinated as soon as we can, and we'll talk about that soon, about how we can make that happen. Now let's move over to Dr. Kumar. Before I turn it over to you, just want to congratulate you on your new role as Director of Infectious Diseases within the transplant program. So no easy task, I'm sure, in the middle of a global pandemic to have to tackle all of that. So very well deserved. Given that, would you like to give us a lay of the land of the transplant program as a whole, and how your program is tackling COVID-19 and what you're seeing from a program-wide basis?
Sure. Thanks very much, Joanne. It's definitely a lot more responsibility. So hi, everybody. As you know, we are really in the midst of a third wave of COVID, and it's really a critical time for Ontario. It's a critical time for us as a transplant community as well. As you heard from Dr. Prasad and Dr. Chaparro, we have had a number of people get very sick from COVID, And that's a very, very difficult situation that we've been in. So I would urge you to register for the vaccine if you haven't already done so. I hope many of you have done that. I can tell you that I spoke to a number of transplant patients with COVID last week, and I can tell you that many of them just had not gotten around to registering for the vaccine. So please, please make it a priority to register for the vaccine and go to your nearest vaccine center to get the vaccine. There are multiple vaccines that are approved by Health Canada, as you know. All of these vaccines are endorsed by our program and by the Canadian Society of Transplantation. So you can get any of the vaccines that are approved by Health Canada currently. So these include the Pfizer vaccine, the Moderna vaccine, AstraZeneca, and Johnson & Johnson once that one rolls out in Canada. The benefits of being vaccinated far outweigh the risk of getting COVID and far outweigh any risk from the vaccine itself. So definitely the benefits outweigh any side effect risk from the COVID vaccine. And I just want to address the AstraZeneca vaccine side effects that we've been hearing a lot in the news. You have been hearing in the news that there are blood clots that some people have gotten that are attributed to the AstraZeneca vaccine. We've had a handful of cases now across Canada. You know, there are very few cases compared to the number of vaccine doses that have been given out. There have been more than 1 million AstraZeneca vaccines given out in Canada, and the cases of these blood clots are really only a handful. And so the possibility of this happening is very, very low. And I want you to think about the possibility of, for example, getting a blood clot from having COVID. The possibility of blood clot from infection itself is much, much greater. So I think the way to think about this is really that, again, the benefits of the vaccine far outweigh the risk of getting COVID and the risk of any side effects from any of these vaccines. So I would encourage you very much to get vaccinated.
Dr. Kumar, you and your colleagues around the world have been doing a lot of research on the vaccines in the transplant population to try to demonstrate the effectiveness of these vaccines and understand what impacts they may or may not be having. Can you shed some light into that research too, and how much has changed perhaps since we talked a month ago?
Right. So thanks again, Joanne. So the latest research shows that 1 dose of the vaccine, now these are primarily the Pfizer and Moderna vaccines, that 1 dose of these vaccines produce an antibody response in very few transplant patients, probably less than 20%. So you really need that second dose. And I can't emphasize that enough, that the second dose is needed and should be given on time as per the product monograph. So we in Ontario do have that recommendation that transplant recipients get the second dose of the vaccine as per the vaccine's product monograph. So now it's a little bit of a downer that the vaccine doesn't work as well in transplant patients. But remember that antibody is not necessarily the whole story either. Vaccine can actually help make T cells, which is another part of our immune system that can fight off COVID. So T cells are immune cells that help to protect us from lung infection. So even if you get infected with COVID, but you're vaccinated, you can avoid the lung infection. You can potentially avoid coming into hospital. So I think it makes it even more critical that everyone get vaccinated. Now, the other thing we've been hearing in terms of research and new things is variants. We have a number of variants circulating in Ontario. The B117 variant, which is the original UK variant, has essentially taken over. So in Ontario, about 80 or 90% of our infections are B117. This one is more contagious, and it's probably responsible for this huge surge in infections that we've been seeing in wave 3 in Ontario. But the good news is that the vaccines that we have currently remain effective for this particular variant, which is the predominant variant now. There are other variants, the variants that arose in South Africa, in Brazil, and there's this double mutant that we've been hearing about that was first reported in India. These mutants are concerning, these variants, because they're more contagious. And for these particular ones, the South Africa, Brazil, and the double mutant, the vaccines might be less effective. So we're trying to see what more research we can do to see how effective the vaccines are going to be with these particular mutants. But the vaccines remain effective against the UK mutant. Luckily, we don't have huge numbers of these newer, double mutants and so on in Ontario. So I think we're very lucky in that way. And remember that the reason the mutants form and transmit is because people are not vaccinated. So the more the people get vaccinated, the number of mutants will also go down. So I think there is a light at the end of the tunnel that the more we all get vaccinated, not only will COVID go down, but so will the number of mutants.
Thank you, Dr. Moore. That's very helpful to put it into context that way and remind us not only are we trying to build antibodies, but the T cells, which are often overlooked in that conversation, and the fact that it's very clear we need to get vaccinated. We need to get, as a transplant community, we need to get vaccinated in the shorter time frame. And we have an active B117 that's very prevalent here in Ontario. So how do we get vaccinated against that? Andrea, let's try to tackle that. The vaccine logistics, as we call it. On Thursday, I had my little button here. I had my second dose of the Pfizer vaccine at the UHN vaccine clinic, and like my first one, everything went very, very smoothly. And I had my letter with me from the transplant center that said that I was eligible to have my second dose in the shorter time frame. So that allowed the center to accept me as a vaccine patient, and very smooth. No issues, and for me, no side effects at all this time. So I think it was a very good experience, and I hope that everybody else watching has that same experience. But things have changed a little bit on how we can register as transplant patients for that second dose. So, Andrea, why don't you walk through what viewers should do now?
I really feel as though I pulled the short straw by getting this section of the talk because it is not actually as smooth as one would hope. I do know of people who had a very smooth operation and everything was great, and that's terrific, but there are probably a lot more that are frustrated. And I just want to say that however frustrated you are, we will work it out. It will settle down, and we will all get our vaccine. And so there you go. So UHN has the Pfizer and Moderna vaccines, but we've had to temporarily close because there is a lack of vaccine, and that's just a fact, of worldwide fact. So there's just a lack of vaccine, and the supply, we're hoping to get much more in the next couple of weeks. We will get much more in the next couple of weeks, and you can go, if you're curious, you can go up on that website of the COVID-19 Ontario Health for updates on the supply itself. As far as like registering to get your vaccine, what we're encouraging people to do is go to the Ministry of Health vaccine registration site, because they can actually go with your postal code and pick a vaccine center that is closer to you. That would make it much less arduous for you to travel, and much easier for you. And you sort of scroll down, pick yourself as if it says transplant patient, or if it says a chronic health condition and you're a caregiver, then you can go under there, and then it takes you through a number of steps actually in order to actually register, and then you'll get an email back with an appointment at a close site close to you. The first dose, you can call or you can register, let them know on the phone call that you are a transplant patient. And then we did close the UHM public registry because the Ministry of Health one is a lot more comprehensive with a lot more information, and they can actually take the higher risk patients sooner, and they just have that capacity now. And so we should just sort of take advantage of the Ministry of Health website from them. The second dose, if you're booked through the Ministry of Health, you'll let them know that you need to have your vaccine at a shorter interval as a transplant patient, and you can bring a letter confirming that you are a transplant patient. Now, one caveat to that, we did send out a generic letter for the majority of our patients regarding this, and that has worked very well until recently, and now they're asking for more details in the letter. Your transplant center is just as disappointed in this as you are. And we are trying to work out the logistics to get all kinds of letters out to seemingly thousands of patients in a very short period of time. But we know about this, and we just want you to know that we are working on it as best we can. If you did register at UHN and you got your first dose at UHN, you'll fill out the second dose change request, and your interval will be shorter, and you'll get your appointment that way. At St. Michael's, it's much the same. There is another second dose change request that you would actually fill out in order to get the shorter interval. Now, one thing, when your caregiver goes to register, they will not get the short interval. They will get their second interval, the same as the general population, which is, I think, 4 months or 112 days. I think it's 4 months afterwards. The change in the drug supply, it is province-wide, and there's nothing that we as a transplant center can do about that, but be rest assured that we are advocating for everyone. And the other complaint that I've had is people say that they're getting their second dose in like 34 days as opposed to 28 days or 37 days. And you know what? That's okay. That's okay. It's shorter than 4 months, and we're really just trying to get as many people fully vaccinated as possible. So if it's 34 days, good. You're still going to take that appointment, and ideally everyone would be within a certain interval, but that's just impossible right now. And I think the next slide is about.
Yeah, I think I'll jump in here
Sure.
quickly, Andrea. So knowing that we were having this conversation today, and even though I did receive my second dose on Thursday, I thought I would call that, if we can go back a slide, I thought I'd call that ministry number to see what would happen should I not have registered yet. And it was, again, a very seamless process. It was not like, when you phone your telecom provider and you're on the phone for hours and hours. I listened to a pretty long intro. It was probably 3 or 4 minutes. And then I spoke to someone on the phone, and I did have to answer some questions about why I would be a high risk health condition patient. And once we had that conversation and I was deemed eligible, it would move very quickly from there. I obviously didn't go through the process to book a vaccine, but what you would need to do is talk about, your condition. And then they would book your first dose, and they'll book your essential caregiver with you as well, if that's something you want to do. And it will be as Andrew said, at a clinic that's close to you in your region. And then they will give you your second dose appointment at 16 weeks. And even though as transplant patients, the community has advocated that we do it faster, you're going to get a 16-week appointment. But that's okay, because once you go to your vaccine clinic, they'll see that you'll let them know that you are a transplant recipient and that you've been eligible for that shorter time frame. And at that time, they will, once you have that letter that Andrea referenced, that does need to have your patient details, your OHIP number, your name, and it needs to be sort of signed by someone. You will then get your first dose, and you'll be given a shorter time frame for your second dose. So very helpful. Ministry of Health call center walked me through all of this. I obviously didn't book, but I encourage those who haven't booked to do that, and I'm sure you'll have a seamless experience as well. And you know, like Andrea, you brought up, I did get a slightly longer time frame. I think it was something like 27 days versus 21 with Pfizer. But just wanted to reiterate that with you, Dr. Kumar, from a research perspective, and from a you're not seeing anything that should make us worried that, you know, 28 days, 36 days, we need to be getting up in arms about that.
Right. So, you know, I think that's a good point to clarify. So, as you know, in the research trials, the research trials always stick to very specific timeframes. So, for example, for the Pfizer vaccine, it's 21 days, and for Moderna, it's 28 days. And for AstraZeneca, it's actually a range between 4 to 12 weeks. So, what the recommendation is for transplant patients is that we stick to what they did in the trials, because that's really the optimal, that's what's going to get you the optimal sort of protection in the transplant setting. But, you know, if it's a few days here and there, that's okay. You know, that's okay. We shouldn't fret about that too much, because, you know, as you know, there's, you know, it's logistics, you know, things get in the way. So we really shouldn't fret about the few days. It's really when you're getting into those long time frames, like, oh, it's going to be 4 months till my next dose. That's the issue. The few days here and there shouldn't really make a difference.
Thank you for clarifying that. I think that will be reassuring to many people joining us today. So I think we've walked through, we talked about how essential caregivers, you can get registered with your patient partner or your loved one, and use that same number. So I think, Andrew, did you want to jump on anything here more about the caregiver?
Just to know that, like, if you're an essential caregiver, it means that you're providing care for that person, sort of direct, frequent, sustained, in person, all of those things. So if you're a transplant patient that lives alone, you can't bring your neighbor that lives 4 doors down. I mean, we just want to try and utilize this very you know, fortunate thing for caregivers. There's only one. You can't bring your family. You know, if there's 10 people that live in your house, you can only pick one, and one would assume that you would pick the one person that you were in most contact with and who was also at high risk, right? And again, the essential caregiver will not get the shorter interval vaccine. They will be with the general public, and so just, you know, you just call on the number or register online with the Ministry of Health site. And hopefully it will be very, very seamless.
That's the plan.
The patients have been telling me that the essential caregiver has to accompany the patient and get their vaccine at the same time.
I heard differently, but that they wouldn't get an appointment at the same time. But, you know, it could be different elsewhere. I guess we'll just sort of see.
Yeah, I think ask that question when you phone the MOH call center very specifically, and so you can get clarity right from them. Why don't we move into our Q&A portion? As I said at the beginning, we did receive lots, like hundreds of questions again from our listeners and our viewers. And we've grouped them into 3 key themes. The continued discussion around vaccine safety, and is it safe for transplant recipients to receive the vaccine? Second is around immunity for vaccinated transplant recipients. And our third theme is, what are some of the post-vaccine recommendations? So we'll jump right into the first theme, and we'll continue the discussion that we've had over the past 2 months on, is it safe for me, a transplant recipient, to get a vaccine? I'm going to start with you, Dr. Chaparro. Is the vaccine still represented for your lung patients and for recipients across all organ groups in Canada? And is there a better vaccine that one should ask for, the Pfizer, Moderna, AstraZeneca?
Thanks, Johan. Well, I think that the phrase that I like the most from the PALI is, the best vaccine is the one that is offered to you. No matter which one is, what time is it now, or is it going to be in a month, or what we have available now, the best vaccine is the one that is offered to you, and the sooner you can get it, the better. So we don't recommend any specific vaccines for any group. So all our lung transplant, heart transplant, liver transplant, all of the organs can receive any vaccine. So any vaccine is good for everyone, and is going to be as effective for every organ across the transplanted patients.
And Dr. Prasad, there's quite a large population of kidney transplant recipients across the country, and we did receive quite a few questions specific to kidney. Is there a preferred vaccine for the kidney population? Anything you want to add here?
Yeah, similar to the much smaller other organ transplant recipient populations, I would say that there is no clear favorite for vaccine. All of them are acceptable to transplant recipients, and I would strongly encourage recipients to get the first vaccine that is available to them and follow the appropriate schedule.
Okay. And we do continue to receive a lot of questions around whether or not the vaccine will interact negatively with the immunosuppressions transplant recipients live on. Dr. Kumar, could you shed some light into this and perhaps speak to, for those that join us every month, has there been any change since what we knew 2 months ago to what we know today?
Right. So thanks again, Joanne. So with regards to the immune suppression, we have not seen any changes in terms of how vaccines interact with the immune suppression. So vaccines do not, for example, increase or decrease tacrolimus levels or cyclosporin levels or sirolimus levels. So there's no impact on the immune suppression directly. Now, a lot of questions have come up in terms of these are new vaccines. Will they affect my organ? Will they cause organ rejection, for example? And I can tell you that around the world, now about thousands of transplant patients have received these vaccines. And there's been a lot of research that has been done with these vaccines in transplant patients. And essentially, we have not seen any signal that these vaccines impact the organ transplanted. So, so far, I can reassure everyone that the vaccines appear to be safe in terms of rejection with regards to the organ that you have transplanted.
Thanks, Dr. Kumar. On the similar note of immunosuppression, Dr. Chaparro, we know that the lung community of transplant recipients tends to have the highest dose of immunosuppression. Does that put a lung transplant recipient at more risk to COVID and to the variants of COVID? And does it make the effectiveness of the vaccine better or worse in a lung transplant patient?
I don't think that there are studies really to say that maybe the lung transplant patients, because they are on a higher level of immunosuppression, will have less response to the vaccine. Let's put it that way. I think that every transplant patient will have a certain level of immunosuppression. And we have to understand that there are times where, let's say, a kidney transplant is having rejection, so that immunosuppression will be higher on them for a certain time. Lung transplant patients, definitely, especially early post-transplant, they are on a higher level of immunosuppression. But as the years go by, they are on a lower immunosuppression. I think that the higher risk, we definitely have to contemplate any level of immunosuppression, but also in lung transplants, the fact of the lungs being exposed easily to air, it makes them a little bit more at a higher risk. I would just caution every transplant patient not to compare with the lungs and being more comfortable that they are not going to be at a higher risk just because they are not lung transplant patients. I think that all of our transplant patients have a risk because they are immunosuppressed, and definitely we would just be emphatic about the importance of continuing doing all the other measures that we use to protect themselves, continue being isolated, etc. So independently of the level or the comfort that you could be because you are years post-transplant or so. So I think that everyone should be very, very mindful about just being immunosuppressed and being aware of that.
That's a great reminder and advice for all of us. Take good caution during this pandemic. I'd like to go to theme 2 now and transition from the questions of immunosuppression to immunity. And once we've been vaccinated the first and the second time, what does that look like for the transplant recipient? Dr. Kumar, there's been a lot of talk in the media about booster shots. We saw the Prime Minister announce that he's ordered millions of booster shots for the future, and we've seen some of the manufacturers start to talk about how there will likely need to be a booster in 12 months and perhaps turns into a yearly vaccine similar to what we might see with the flu shot. Can you shed some light into that conversation?
Right. Thanks, Joanne. So I would say there are two ways of thinking about boosters. The first way to think about a booster is, should we just get more of the same vaccine that we've gotten? So there are 2 doses of Pfizer vaccine or 2 doses Moderna, AstraZeneca, et cetera. Should we just get a 3rd dose, and will that boost the antibody response and protect transplant patients more? So we know that from the flu shot, for example, if you give more of the flu shots, if you give a higher dose of the flu shot, we know that transplant patients make more antibodies. So the same might be true for the COVID vaccine. And there is research ongoing to see if transplant patients may need more than the 2 shots that are currently being given. So that's sort of a research thing, and we don't know the answer to that yet. The second way of thinking about boosters is, should we be giving an extra vaccine for these variants that are circulating? Because the variants are not well covered by the current vaccines. We know that Pfizer and Moderna and other companies are in the process of making these boosters to cover the variants as well. And it's possible that later this year or early next year, we will have a booster vaccine that works against variants. So I would stay tuned for that. I think if a booster vaccine is recommended for everybody, I think transplant recipients will also be eligible for the booster vaccine. So I would just stay tuned in terms of whether we're going to to have boosters or not.
So if someone today who's a transplant recipient is a bit hesitant about getting a vaccine, and they hear about the concept of these variants, and there might be a new a booster vaccine that addresses the variants, what would you say to them if they asked, should I wait?
Right. So if you wait, you basically risk getting COVID. We don't know when these boosters will be available. It might be a year. We don't know in which countries they will be available first. Will they be available in Canada right away or not? You basically risk getting COVID as you wait, and you leave yourself unprotected. So I would say, if boosters are available, you're going to get it anyways when they're available. But while you're waiting, you should at least be protected against the strains that we currently have. And so I would say, get your 2 doses of vaccine now, be protected, and then let's wait for the boosters if they come along.
Okay. And what's the science on mixing doses? So getting your first is Pfizer, your second is Moderna, or your first and second is one, and your third, your booster, or even mixing between what we know as, or what the media talk about as the mRNA vaccines versus the more traditional live virus vaccines. Mixing and matching, good or bad?
Yeah, so mixing and matching is what we're talking about today. So, we just don't know. There are studies ongoing that, there are ongoing people who've gotten, for example, the AstraZeneca vaccine first. Can they get the Pfizer vaccine as their second dose, for example? Will the Pfizer vaccine boost the AstraZeneca vaccine or not? So these are questions that are out there. We just don't know. But for now, the recommendation is to stick to the same vaccine that you got as your first dose. So same one that you got as your first dose, you should get as your subsequent dose. That's the basic recommendation now, but I'm sure, in the next few months, we're going to be hearing a lot about mixing and matching vaccines.
As we've learned over these 2 months, things do change rapidly, so we'll be sure to check back in then. But for now, I think avoid mixing and matching, and get vaccinated because it's tackling the current variants. I'm sure, myself included, a lot of patients are curious about the antibody level or the T cell level, if that's the right scientific terminology, that they're building post-vaccines, dose 1 and dose 2. Dr. Prasad, are you recommending to your patients to get some form of antibody testing? Or are you making this available? Do you think it's a helpful data point to share?
I would just like to emphasize one thing first, and that is that I've been hearing reports out of the United States that there are many individuals, young adults typically, who are not showing up for their second dose, feeling that they have immunity after just one shot, and that is something I would strongly discourage anyone from pursuing. It really is important to get that second vaccine dose. Otherwise, as Dr. Kumar mentioned earlier, you're simply not protected enough. We are not testing antibodies in our patients. The only reason to test a patient for antibodies is if it would lead to some meaningful change in management, and at the moment, there isn't. So any test performed has to lead to a potential change in management. And until we get more data to see how effective and to what extent the 2 doses are effective and whether a booster is necessary, I don't see a role in day-to-day practice for antibody testing.
Okay, that's good to know. So hopefully it won't inundate the coordinators with such questions and requests. Before we move on to our third theme, does anyone want to add anything around the immunity question and around the dose questions that we haven't touched on?
Yeah, I'll just emphasize what Dr. Prasad said, that measuring antibody levels is something we're doing in research, but to do it, just so that you could do it to reassure yourself, but it's not really reassurance, because number one, we don't know at which antibody level you are protected. So are you protected at a level of 5 or 10 or 1,000? We actually don't know that yet. So I think that would be one very important thing to realize, that even if you get an antibody level back that gives you a number, you actually don't know what that number represents. Does it actually represent protection? And that's why we're not really saying to go ahead and get your antibody measured. The other thing is the antibody tests that are out there. For example, Life Labs has an antibody test that they offer. Those tests might not pick up vaccine protection. What they do is that they pick up whether you've had COVID in the past, but they don't necessarily pick up the protection you've gotten from vaccines. So I think just be careful if you're searching for antibody levels, measuring your own antibody levels, because the test might not be the right test and you don't really know what those numbers mean.
Well, thank you both for sort of emphasizing that, because I think when we saw research come out that showed the transplant community wasn't building as many antibodies, there was a sense of disappointment. But then as I reflected on it as a patient, I quickly realized, well, as transplant recipients, you leave the hospital, you get told so much about the new reality of this amazing gift of life and this new lease on life, but you do live on immunosuppression. So you understand that you always have to live with a bit of caution. And of course, it's not going to be different during the pandemic. And of course, as I try to relate it, we weren't going to build, the perfect immunity that we might have hoped for, but it's no different from our daily lives. So I think that's the same mentality we can bring into this, that everything helps, but we always have to be cautious and recognize that we do live with this great gift that comes with, a bit of immunosuppression. So on that, I thought we could transition to theme 3, which is we've been vaccinated. We've had our second doses. Obviously, we're still living in a pandemic, a pretty significant wave here in Ontario that we can all be optimistic that it will kind of pass. But it's an active pandemic. And I'd like to discuss recommendations on how to live life once you've been fully vaccinated. So Dr. Kumar, let's start with you on some general do's and don'ts in the context of being fully vaccinated.
So if you've gotten both doses of vaccine, I would continue to encourage you to continue to follow good public health practices, still wear a mask, still distance, still wash your hands. Number one, because we don't know how protective these vaccines are in the transplant setting. And number two, because there are variants out there that, may not be, that the vaccine may not protect you 100% against. So So at this point, there's really no change, I would say, in how you should behave before you've gotten vaccinated or after you've gotten both doses. Now, we hope that with increasing vaccination numbers, the COVID infections go down. We've seen that in other countries. They aren't going down yet in Ontario, so just be careful. But I remain optimistic that the more people that get vaccinated, that we can really get our COVID numbers down. So keep your guard up, and if you haven't gotten your vaccine, then please do so.
Dr. Chaparro, in your clinic, what advice are you giving to your patients in terms of having had both vaccines?
I think that just to reemphasize what Dr. Kumar has said, we should continue keeping the public health recommendations. So wear a mask, keep your distance, wash your hands. And as Dr. Kumar said, we need to really get a great number of decreased infections and decrease people getting sick, especially when we are talking about transplanted patients, before we really remove the mask or be comfortable going into gatherings or anything like that. So we still have a lot to go. And what is being said also, the proportion of people who have been vaccinated have to be very high, close to 70% or so, to be able to really start losing those restrictions. So for now, we just continue as we are and don't be confident. If people, as Dr. Prasad was saying, won't come because they got one shot and feel comfortable, even with the 2 shots, we are not comfortable, we are not secure, and we just have to emphasize, unfortunately for now, we'll continue using strong measures.
Great, thank you. Dr. Prasad, anything you'd like to add on that front?
Yeah, there are 2 things I would like to add. The first is, after your transplant, and even if you have been fully vaccinated, if you happen to be exposed to someone with COVID, or if you develop any of the early symptoms that might be attributable to COVID, such as a low-grade fever, please get yourself tested. It is important, both for your own health and to protect the people around you, and follow the current public health guidelines with what needs to be done if you turn out to be COVID positive. And if you do turn out to be COVID positive, please inform the transplant program. This may have implications for your transplant health and your overall health in particular. We need to know, so please inform us so that we can make adjustments if necessary to your medications, help monitor you, and perhaps help you access healthcare. The second thing I would like to add is we have a number of patients, as you know, who are on the waiting list for a kidney transplant. We continue to do deceased donor kidney transplants because, fortunately, for our community, they are considered emergent life-saving surgeries. And I strongly encourage all patients with end-stage kidney disease who are waiting for a kidney transplant to get yourselves vaccinated. And it's really in your best interest to receive the vaccine, so that when you come into the hospital for your transplant, you are doing so in an environment that is safe to you.
Thank you. Those are great reminders and great guidance on how to seek care and how to navigate life in the pandemic. And I think what's very clear to me coming out of this conversation is get vaccinated as soon as possible, and follow through on getting your second dose as efficiently as possible. But then also, of course, continue to follow all public health measures as we do navigate the pandemic. When I reflected on, okay, I'm fully vaccinated, I'm following all the pandemics, what else can I do as I try to stay safe? But I watch with great gratitude having had both doses and know that the transplant community has been such strong advocates to the science and getting our patient community vaccinated. But also all of the work of everyone at the hospitals and all the frontline care providers, all of you on the call and the teams behind you, there's so much gratitude for what you're doing, and how can we, the patients in our community, show that gratitude? And I think one, it's following public health measures, and it's making sure we do our part to not overburden or fully push the hospital systems to the max. A little bit more playful, UHN is hosting Give a Shift next weekend. You can go to the website at I thought it was giveashift.ca, or there's one up here too, where it lets you virtually show that gratitude and show that support to the entire healthcare community, and to specifically in this case the community at UHN. And you can join a team, you can do it yourself, you can financially support, you can build awareness on social media, you can commit. I've committed to trying to wear my N95 for a 12-hour shift. And although I won't be caring for people, so I think my 12-hour shift is going to be a lot easier than the healthcare workers. And I've also committed to doing 15,000 steps a day to sort of put myself in the shoes of these amazing, and the amazing healthcare workers who have just been tirelessly working and tirelessly championing patients. So I found that as a great way to say thank you. And I hope some of our viewers today will join Give a Shift and show their gratitude as well. I also want to, again, call out Dr. Kumar. I read that you and Dr. Kumar received a Transplant Champion Award from the Trillium Gift of Life Network just recently. And again, congratulations on that very well-deserved award. I know the two of you and the team and everybody on this call, I'll say it again, you've just been huge advocates. And to know that we are living through this devastating pandemic, but there's people on our sides, from a patient, from the community, it's so well-deserved. Thank you. And I know it speaks to both the two of you and your incredible teams around you. This isn't in the script, but I'll pass it back to you if there's anything you want to add there.
Yeah, thanks very much, Joanne. You know, we at the transplant program here at UHN and also at St. Mike's and all the transplant programs across Ontario and Canada have really come together. And we're working as a team to make sure, you know, all our practices are harmonized, that we've got all the recommendations, and we're all advocating for all of you. You know, our transplant recipients, those of you that are waiting for transplants, the caregivers for transplant recipients, we're really working hard for you, advocating for you. And I know it's a time of high anxiety. We're all missing friends, we're missing family, we're missing traveling, but don't give up. Don't let your guard down. You know, continue to have that vigilance, protect yourself from COVID. And so that's basically what I wanted to end with. And I also wanted to say that to thank everyone for participating in our local COVID research that's been going on at UHN. And it's been really helpful. It's actually has allowed us to advocate for you. So, you know, the way that you've given your time for research has helped us to advocate for you at the national and provincial levels. So I just want to thank everybody for that.
What a wonderful way to leave off our session on a positive note with some hope about what's to come. So thank you to the four of you for joining us again this afternoon. And thank you to everybody who has logged on and who's watching us online. We appreciate that these conversations are well received, and perhaps we'll have another one in the coming months when things will likely continue to change as they rapidly do so. You can find additional resources for the COVID-19 vaccines on the Canadian and American Society of Transportation website. The sites are up here on the screen. And just a quick reminder that if you're going to any UHN hospital or to the St. Mike's Hospital, please review the policies in advance. There is currently a no visitor policy at all of the sites. I'll remind you, you can fill out the patient portal where you can quickly fill out the screen so you can move through lines more quickly if you are going. And then we just want to say thank you again to Acela Pharma for making these sessions possible, and the ongoing support of the UHN Foundation. And of course, the Center for Living Organ Donation team and everyone at the Ajmeri Transplant Center. And today was really great to partner with St. Mike's. So we truly are all in this together. Thanks everybody, and enjoy your afternoon.